Hello. Good morning, everyone. Hello,
Good
Justin,
morning.
Damien, Justine, Zach, Mara, Joanna. How is everyone? Annette, Summer, Marina.
Good
Good
morning.
morning, good morning, good morning. I'm joining from my cell phone. My computer is updating, decided to update, but it is almost done. So maybe 5 more minutes and I will join from my laptop. Okay,
Okay.
guys?
Okay,
Yes.
thank you.
Yes. Yeah. Thank you for the weekenders. You're not done yet and you're joining to finish up strong. Yes.
Yes.
Why is it done? Yes. Hi. Good morning again, everyone. Good morning, lovely people here. Good morning, everyone. How's it going today? Weekdays. What time did you wake up today? Weekdays, guys.
15 minutes ago.
Yeah, right. How it feels. How it feels. Different, amazing, right? Because I know the weekenders, weekdays, they wake up at 5 o'clock or maybe earlier, right? Okay, I'm glad you guys done. I'm glad, and weekend also will be done very soon. Will be done on Sunday, and that's it. Now you celebrate your accomplishment, and we are at the finish line. Why we're meeting today? We're meeting today because we need to take another step after we finish nursing school, which is something amazing. It's a long journey, it's not an easy journey at all. And I understand all the effort, all the tears you put, and I know how that was long and not the easiest thing. So now you're done.
Mm.
So let's prepare for the big step because you have been in nursing school and you have done all that for a reason. What is a golden reason why you even joined nursing school, why you finished nursing school? To take the board and pass and start working, right? Without taking that exam, nursing school will not make any difference. Make sense? Can we just have nursing school done and we don't take the board? Will the nursing school even be meaningful? Will it help with anything? Nothing. Nothing. It has to be the board. So, the board preparation, guys, is a straightforward way. Exactly. We need the license, Michaela. We need the license to start working. Board preparation, it's a straight way. And I found the way, this straight way, because there are many ways to one destination, right? Sometimes you go straight, sometimes you go like this, right, left, right, left, right, left. Sometimes you lost and come back, right? Do you agree? There are one destination, but there are a straight way to the destination, and there are some other ways to the destination. So, do we agree on that?
Yes.
So, we're here to find the straight way to the destination. What is the straight way which will make your which will make you reach your destination fast and safe, because you don't want to fall in any trap. You don't want to be unsafe going not prepared, right? So you're here today to get the straight way to your destination. What we need to pass NCLEX. Finishing nursing school by itself is not, it is 90%. Finishing nursing school is 90% of your route of this straight way. Then we have 10%. This 10% is crucial. We cannot just go without this 10%. This 10%, we will do it during the upcoming 2 to 3 weeks. So, check the date of graduation and put your goal to reach to your destination 2 to 3 weeks only. Okay? What are we going to do during these 2 to 3 weeks? We will practice exam questions, and we will let the exam questions tell us what concept we want to brush on, because you have many concepts you need to be aware of. Have you checked my final lab packet? It has all the concepts. Who didn't get the final lab?
Yes.
Anybody?
Did you put it in the group chat?
The final lab packet, I sent it. Oh, somebody put it in the chat?
Yeah.
Yeah, I put it in ours as well.
In the chat, like group chat. Oh, Jocelyn, you're here.
Yeah.
You said yeah, I will not. Okay.
I'm barely here.
Okay. Yeah. Okay. So, you mean group chat? The group me, right?
Yes, I put in the group me for
Yes.
evening.
Perfect, perfect, perfect. Okay, so are you guys going to stay off camera all the session? It's a long session for me to have just cameras to talk, like closed ones to talk to. Before we start, would you like to have longer day, little bit longer day today, and just have it all in one day instead of 2 days?
How much more longer?
Good question. It will not be like, it might be up to 4 p.m. Yeah, better than 2 days. So I would like you to have a day off plus your weekend. Thank you, Damien. I know you will open the camera to make me feel better. Okay, so would you like to have it all in one day? Yes, yes, I got many yeses. Yes.
Oh, sure. Yeah, today.
Yes, okay. So you all chose this. Okay. Yes, please. So that will be a good or better option for you. Yes. Okay. Let's do it all in one day. Okay. Okay.
Dr. Manal, are you recording it yet?
I have not started yet. Once I start talking about the topics, this is introduction. It will take me a few minutes and then I'm going to start recording. And Jose, are you here? Jose,
Yeah.
you said in the setting, I can give you an option, you record.
Yeah. There should be one
How?
for you to allow to record.
Huh?
I don't know where exactly it is, but there should be one in settings.
I
But if
have the
not, I mean,
setting,
the
but the
settings.
security, accessibility,
Uh,
accessibility, always show caption. Oh, Concord prevented that. No, I went into the setting. No.
oh, doesn't let us.
Uh-uh.
Oh.
Okay. Okay. It's okay. I will record. But here you go. I want to celebrate you first. I want to say welcome today. And let's make this happen fast. Instead of even 2 days, I will do 1 day. I know you're eager to rest and celebrate finishing the school. And we're not here to repeat nursing school. We're not here to repeat nursing school at all. May you mute yourself, guys, please? And just unmute whenever you want to say something. Okay, so we're not here to repeat nursing school, but we will brush on the high yield NCLEX topics you have already studied. Yes? So we need to take it very serious over the upcoming 2 to 3 weeks to be done that fast. We need to put the effort. And we always, the NCLEX preparators, advise to take at least 1,200 to 1,500 new questions. So reset your Saunders if you're using Saunders. If no, you're not using Saunders, you need to get whatever you want to get. As we discussed, there are 2 resources, either the Archer one or the UWorld one. But again, to avoid any confusion, you don't have to. This is when people ask what resource I can use. These are the best 2 in the market. Archer is cheaper if you look for a cheaper option, because UWorld, it is not cheap. It is Archer, you can buy the QBank only. So if you want to buy the QBank only, you don't need the videos, because to be honest, videos are free online everywhere. So you might buy the QBank only for the Archer one. It is 79, I believe. And then UWorld, there is a whole packet. You cannot just buy QBank only. It has to be with the videos, and it is above $100. And as I said, get the free trial of each if you want to buy something, and find which one you like better. And I can help you to start your free trial at any time. Again, it's not a must. You can stick with Saunders. Okay. So, but anyway, you want to do at least 1,200 to 1,500 new questions, or complete minimum of 10 to 12 practice exams, and passing all these exams the 2 or 3 weeks before your NCLEX date. So each exam will be your tutor. Each exam, it will not be, oh, I will take this exam, I can take another one tomorrow, I can take another one tomorrow, I will take all of them one after one, I can finish all these exams in 5 days. It is not this. You need to take an exam and break it down and study each concept in the exam. Remind yourself with each concept. Like if you have question on gates, like helping patient with 3-point gate or 2-point gate, I'm gonna go study the gates. I'm gonna go study assistive devices like canes, all this stuff. So the exam questions will guide you what you should study. So that should be time consuming. That will consume time. So my advice is, over the 2 weeks, you can take 10 exams. And the exams will help you to brush on the topics you want to brush on. The exam will remind you here, hey, there is a topic and you missed the question on it. Go study this. This is the exams plus the final lab packet I sent you guys. This final lab packet, I will go over it right now. It has the topics which are high yield per board. So the board, it has certain concepts. We took these concepts and created this for you guys. So also, while you're taking exams, you need to put like very brief notes, right? As usual, you put very brief notes. So you put your notes plus this final lab packet combined, it will be your key study guide. Key study guide, do I need key study guide? Yes, because 2 days before your NCLEX, during your final 48 hours after you have a test date, the final 48 hours, you need to stop taking exams. You cannot take exams 48 hours before your NCLEX. You need to stop taking exams and reread this study guide. For sure, we will keep revisiting and rereading the study guide, which is the packet plus your notes, but it is crucial you have this key study guide in one resource, which is your packet plus your notes, to read it all again 48 hours before your test date. You will focus on reviewing these notes to solidify your knowledge. Yes? So this is the idea of the preparation for NCLEX, right? So let's celebrate your accomplishment first, guys. We forgot to celebrate, right? Congratulations, everyone. Weekenders, you're almost done. Yes, your weekend will be this weekend, the last weekend. Congratulations. I'm so proud of each one of you. Okay, let's get back to the NCLEX. NCLEX is not a joke, guys. It is 100% understandable. Somebody may be anxious about taking the test, and you want to enter the exam room knowing that you have done everything possible to prepare, right? Also, I understand that you don't want to spend any more time studying than you have to. So let's make it very well prepared. Like you don't do too long or you don't do too short preparation. You don't throw yourself or you don't spend longer time than you need. So you need to, I will start recording. Yeah, everyone agree on recording. Yeah, you guys, I'm waiting
Yes.
for everyone.
Yes.
Yeah,
Mhm.
interact,
Yes,
and
thank
I will
you.
appreciate weekdays, guys. You always have the camera on. Come on, open your camera, wash your face, open your camera. I know you just woke up. So recording here. I'm gonna record. Start recording. Yes, confirm. Okay, guys, so we started to record this and you all agreed on recording. Fantastic. Okay, so first of all, we want to recognize the NCLEX format. We want to know what kind of format we're going to see, what kind of like the way they administer the exam. So I will show you quickly the NCLEX format. Then we will develop a study plan together. I will show you how to develop a study plan. And you need to put a stress management plan. And I know many of you in this session, you need to work on your anxiousness, on your stress. So let's designate time when we meet to talk about stress management plan. Part of the stress management is to take care of yourself, by the way. We will talk about this based on one-on-one basis. So, number one, we will recognize the format right now, and we will develop a study plan right now. And let's talk about stress management because it is even as important as being academically ready. So this is a format, guys. This part is your PN. So let's focus here. So let's know what will happen during the test. During the test, you have range of questions, 85 to 150. It may stop at any time between 85 to 150. Okay? Does it matter if you stop at 85 or 150? It doesn't matter at all. Don't think 85, yeah, I stopped at 85 and passed. People sometimes they stop at 85 and do not make it. Yes? So I love your background, Roxanne. Very nice one. So people sometimes stop at 85 and they don't make it. So go with the attitude of one more question, one more chance. Most of the people, they go all the way to 150 based on the board. Yeah, based on the board references, most of the people go all the way to 150. Yes, so don't be fooled by people when they say, oh, I stopped at 85. Some people stop at 85 and it goes very bad, they don't pass, right? So number is just a number. Maximum time is 5 hours, and they will offer you 2 breaks, guys. Every 2 hours there is a break, and the screen will shut down and tell you, okay, you have been working for 2 hours, you have an option to take a break. You may take the break or you may decline the break. If you feel you're in the momentum, you don't want to take the break, don't take it. Or you want to take a break, take it. When you take a break, you get out of the computer room. When you're coming back, they will search you again. So breaks are allowed, but kind of time consuming. Any break you take, it will be deducted from the 5 hours. So if you are a slow test taker, we will work on your pace because you need to finish in appropriate time. And you don't need to spend too long taking the exam. That will make you overthink. So also we will talk about your pace. First 85 questions, guys, you will see 3 sets of case studies. Each case study, it has how many questions? We know that. How many questions in each case study?
6.
6. It will be 6 questions, Raiden. Thank you. It could be up to 5. Wow. 5 unfolding? Oh my God. Yes, some people, they come and say, oh, all my exam was case study and NGN. It happens. If they give you 5 unfolding plus the standalone NGN, the 3 only will be for scores, for scoring. Can you imagine? 3 only for scoring. 2 are not for scoring. So you don't know which one. You don't know which that first 3, last 3. You have no idea. You keep doing your best, but you may expect 5 unfolding. Plus standalone, like the single case study, the bow tie, the grid, that will be from 7 to 10% of your exam. Percentage of NGN overall, which is case study plus standalone, is 25% if you stop at minimum exam. Like if you get 85 questions, it will be 25% NGN. If you go all the way to 150, it will be 18% NGN. So this is the format you will expect. Then let's put a study plan. Listen, everyone now, you want to know how to put your own study plan, your nurses, you know how to do this. Study plan, everyone, paper and pen, and please write here. There are 2 steps you need to take when you put a study plan. Number 1, you need to set up a goal. Number 2, timeline. Timeline, I want everyone now, don't tell me, but you put your timeline. Am I going to test in 2 weeks? I am going to test in 3 weeks. I need 4 weeks. Yeah? So put your timeline. 2 weeks or 3 weeks or 4 weeks. Don't go beyond the 4 weeks because we have many things in our head right now. You have the most knowledge right now. So put your timeline, okay? Number 2, we put a goal. What is our goal during this timeline? What you want to do during this timeline? We just said you need to take new questions, like at 1200 to 1500 new questions. You cannot just repeat the questions you have been taking and go and say, I am ready. 1200 questions to 1500 questions, that is almost 10 exams, 10 comprehensive exams. 10 comprehensive exam during the 2 weeks or the 3 weeks or the 4 weeks. Consistency in scoring well is the key. The 10 exams you take, has to be no low scores in between. Like if I take 3 exams, it went well, I scored well, and then 2 exams I didn't score well. Start over. Start to count your 10 straightforward pass exams before your 2 weeks. You cannot go in 2 weeks and your exam score up and down, up and down, up and down. What will happen if your NCLEX was one of the down? Right? You need a straightforward good performance. Okay. Again, don't take more than 4 weeks. Use your calendar, guys, because if you decided you go within 2 weeks, you can make the 2 weeks 4 weeks. Really? I can make the 2 weeks feels like 4 weeks? Yes. Because if you write it down every single day you commit to study, mark your calendar as AM and PM like this. Like if like today is here, I will do 2 weeks, so I'm going to test after 2 weeks. This is my test date. Every day, I'm going to do AM session, PM session. AM, PM. 2 hours in the morning, 2 hours in the evening, total of 4. How many hours should we study a day for NCLEX? How many hours? Minimum of 4. 4 is good. 4 is very good. 2 hours in the morning, 2 hours in the evening. I will take an exam in the morning. I'm going to study this exam afternoon time. Yeah? You may take more time than 2 hours even to study the exam. I want you to focus while you're studying exams because you want to use the exams as your tutor. So make sure you print out a calendar. If you need a calendar, I have many. I will print for May. I will print you a calendar for May. So you take the May calendar and plug in the days you will study, because some of you guys work, so you might not study every day. You might skip one day or couple days. So plug in the time you will study and then go AM and PM. Okay? How NCLEX like? NCLEX is like hunter game. Have you heard about the hunter game? Yeah? How is the hunter game looks like, Damien? Polls? Yeah, you're on mute. Still on mute.
Dr. Manal, what do you mean by hunter game? You mean Hunger Games?
Hunter. Hunter?
Oh.
Yeah, you're on mute, Damien. Okay, I will take it. I will take over here. So it's a game, it's an old one. They try to put the person in different pools. One pool is water. One pool is like colored balls. One pool is fire. So they try to put the player in many pools, and the player has to come or get out of the pool. To win, you need to get out of the pool. So NCLEX is like this. They will throw us in different pools, like one pool for delegation. You want to make sure you're good in that. So to get out of this pool. One pool is for isolation precaution, infection control. So they put you here, they throw you questions, you need to pass the question to get out of the pool. And then another pool like farm, as example, farm questions. Again, you want to show that you're safe nurse to administer medication and you're aware of the dangerous medications to get out of the pool. If any time you were not able to get out, or like they give you question on infection control, first question you didn't answer, second you didn't answer, they will keep giving you question on that topic. Yes, so that is why, guys, we want to make sure we have 3 challenging area, 3 weak areas. We cannot go weak in big areas like infection control or delegation or prioritization. These are big areas. We want to make sure we're very strong so we will not fall into any pool. And this diagram, it shows you this. So this is the red line. This is a pass line. We want to be all the time above the pass line, above average. So that's why we want to pass exams with average score, above average score. You don't want to be below average score. So if you're most of the time above this red line, you will pass. If you're most of the time below the average score, that will not be a good thing. If you look here, you don't need to go up. You don't need, so to pass, you don't need to be like this. You don't need to be, look. To pass, you don't need to go up like this. See, you don't be a rock star. You don't want to be, or you don't have to be a rock star. You may be staying here just above the average, right? And we will make sure every exam you take, it will be above average, okay? So this is what we said. Make sure your notes are brief and short so you can go back and read them. Okay, let's do our best at this moment. That will put you in the best place next moment. Do we agree? If we agree, just thumbs up. Yes, we will do our best now, so we will be at the best place very soon. Okay, so what is a table of content? What are we going to break down right now? We will break down ABGs, delegation, prioritization, because this is NCLEX topics, isolation precaution, ethics, and then adult health, because unfolding case study will be from adult health topics. It will be either neuro, like stroke, meningitis, Parkinson's, Alzheimer, neuro, or the unfolding or the standalone respiratory, like COPD, asthma, cardiovascular, gastro, renal, endocrine, musculoskeletal. So this is also mental health topics. You need to brush on that. Maternity, peds, growth and development, and form. So this is what we will break down. Everyone got the packet, the final lab, which will align with what we will present in this PowerPoint. So I want to make sure you're familiar with what you got. This is what you got. It is all in one NCLEX Sprint because it is really fast. It doesn't have details, but it has very quick reminder of the content of your NCLEX. So this is our table of content, these topics I just mentioned. So you start by very quick review on acid base. Make sure like how I study. I will look acid base. Am I good in this? Did I answer enough questions on this? If yes, check mark. Yes, consider this final lab is your shopping list. You know, when you have a shopping list and you buy something, check, 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 right? So consider this my shopping list. This is the list I'm going to finish to make sure I'm ready to go. So ABGs, am I good? Did I answer enough question? Do I understand this? If yes, check mark. Prioritization. Prioritization is crucial. Most of the question about what need to be done first, what is the most important. Yeah. So remember, we use either Maslow, we use nursing process, we use spectrum of stability. I will not go over prioritization because we just talked about it tons of times. But you remember this. Delegation is crucial. Again, if you I answered the good questions on delegation. Do I know how to understand each role, each scope of practice? If yes, check mark. Isolation precaution, guys, I cannot tell you how important is this. This is so important. So I collected all in one table. You know, you need to know what is airborne versus droplet versus contact versus neutropenic. So this is all here for you to review. Then ethics, very quick reminder of ethics rules. Make sure you know each one and how to recognize each one in the scenario given. Neuro, what I want to study in neuro, that was term, what term? 3 or 4? Term 4.
4.
Neuro, yes, you're right. It was term 4. So what we need to study? What part of the neuro? Should I go to the all PowerPoints in term 4? Actually, no. Here you go. Remember your quick nervous system anatomy, and then remember Perla, Glasgow Coma Scale, meningitis, basilar skull fracture, head injury, autonomic dysreflexia, headaches, types of headaches, stroke, Parkinson's, Huntington, MS, multiple Guillain-Barré, myasthenia gravis, Alzheimer disease, neuro, right? And so on. So this is your checklist. Like, did I see questions on that? Do I know what is that? Do I know what is a nursing intervention on that? If you know it, yes, check mark, check mark, check mark. Yes. And sometimes you have questions on Parkinson's as example. You might put notes in here. You might use this packet to put notes. Maybe you have the tablet, you can download this and add on it. Or some people, they print it, add on it. Or you just have your notes separately, but I'm just giving you ideas. So you can add all your notes here. They are 36 pages, not even 40. And you see how the page is like not big, it is just big line. So 40, it has all what you need, plus you may add notes from questions. So this will be your key study guide. Now you understand what key study guide is. This plus your notes. Last 40 hours, I will not take exams. I will do read to focus on the concepts. Yes? Okay,
Yes.
great. So let's start on the first concept. I decided to start on, do you see the PowerPoint? No? Yes? No. So no.
No, we don't.
So I decided to start to break down. So we will start from the mid-surge part, guys. Because we said we will wrap it all in one day. You all agreed on that. So we will start from the mid-surge part. Let's do, okay, mid-surge first. So here you go. The first part of the mid-surge is neuro. Yeah? So we will start the mid-surge and then we will go back. The first part of the mid-surge is the neuro part. Okay. Neurological disorders. Let's review. Let's remember together. First thing which commonly asked is cerebrovascular accident, guys, which is a stroke. Stroke is what? Is lack of what? Blood supply, which is oxygen and the nutrient. Fantastic. Elizabeth, lack of oxygen and the nutrient, which is blood supply, to certain area of the brain. Could be here, could be here, could be here, right? Could be any area. And the finding of stroke, like the consequences, physical impairment of stroke, it depends on where the stroke happened. If the stroke happened in the frontal lobe or the occipital lobe or parietal lobe, because there are many lobes here. Look at the brain, it has many lobes. The red color called frontal lobe. What is the function of this frontal lobe? We need to know the function of the lobe, of each lobe. You see how many lobes? You see 4 here on this side, and there is 4 on the other side. We need to know the name of each lobe and the function of each lobe. So when there is a stroke in certain lobe, we will know what impairment will happen to the patient, because they will give you, patient got stroke in occipital lobe. What impairment the nurse expect, or what impairment the nurse will find during assessment?
Blindness?
Yes? Sorry?
Vision changes,
Blindness?
Yes, very good. Very good job. Blindness. If it occipital lobe, the consequence is blindness, vision impairment. Why? Because occipital lobe function, it has something to do with vision. Yes? So let's know the name of each lobe and the function so we can know the impairment. So good job, guys. Occipital lobe, this one at the end, it is for vision. Very good. It is visual. Then motor function is in the frontal lobe. So if the stroke is in the frontal lobe, it will be
Higher thinking?
motor impairment, yes. And for sure, cognition, higher thinking, yes. So if there is a stroke in the frontal lobe, it will be what impairment? Since frontal lobe responsible for motor function, so what will be the impairment?
Like paralysis?
Paralysis. Very good. Paralysis, right? Because motor function means there is no movement. If there is a stroke, it will be paralysis. And the paralysis, guys, will be opposite side. Like if there is a stroke on the left side for the frontal lobe, on the left side, paralysis will be on the other side. Half of the body will be paralyzed. And this is called hemiplegia. Hemiplegia means paralysis on one half of the body, like the upper limb and the lower limb on one side. So this is when there is frontal lobe stroke, paralysis or hemiplegia on the other side. And for sure, as Justin said, there is intellectual problem, like cognitive problem, higher thinking problem. This is a frontal. Parietal is this one, parietal lobe, and it functions in sensation. So they lose sensation. What is a word of loss of sensation or sensory problems? Paraplegia. Paraplegia, right? Paraplegia is loss of sensation, and also it will be on the opposite half of the body. Problem in the temporal lobe, it will cause hearing problems. Temporal lobe, this one, hearing a problem. Okay. Then there is cerebellum, or the little brain. Do you see the little brain? This is the lower part here. If stroke in this cerebellum, it will be lack of balance, because the balance happens at the cerebellum. So they will have lack of balance. They might have something called ataxia or lack of balance. Okay. Let me start the subtitle so you can hear and see the word written. Okay, so Stroke could be just bleeding, hemorrhagic, or blood clot. If there is hemorrhagic stroke, make sure there will be very bad headache. The patient will say, this is the worst headache in my life. And if there is bleeding inside the cranial cavity, so that you expect increased intracranial pressure, right? Okay. So watch or assess for intracranial pressure signs and symptoms. If there is blood clot cause a stroke, which is thrombotic, blood clot, thrombus, or embolus cause a stroke, they might give TPA. TPA, like what medication is TPA? Give me a name of medication. What is the name of any medication? TPA, like Atiplase. This TPA, guys, to dissolve the blood clot. To dissolve the blood clot. And it has to be given very fast, within 4 hours from the onset of the symptoms, because after 4 hours, that might cause bleeding. So it has to be fast because it dissolves the blood clot. It's a very heavy blood thinner. Yeah. So what do you think? This TPA, which will dissolve the blood clot or the thrombus, will be contraindicated in what patient? What patient it is not safe to give TPA? This is a very strong blood thinner to dissolve the clot. What patient? What do you think? What patient we shouldn't give TPA?
This
Walrus?
might sound dumb, but is it nitro?
Why nitro?
I don't know. It's just something in my brain telling me that it's nitro.
You always make sure I know why I'm saying this or why I chose the answer. I don't see a reason.
Would it be
Fall
a
risk?
hemophilia patient?
Patient, yes, good job, Mojabing. Patient with risk of bleeding, like hemophilia is one of them. Hemophilia, they always have like easy bleeding. Patient with hemophilia, they just bruise and bleed with a minor trauma, and you give them TPA, they will bleed until death. Yeah. So patient like hemophilia patient tendency to bleed, like have like hemophilia, or patient with recent surgery. They just had surgery. They have open wound, like they just have wound. So we cannot give them something to make him actively bleed, right? So this is a contraindication of TPA. Patient with tendency to bleed or recent surgery. Very good. Then sometimes after stroke, let's talk about Brudzinski, Kernig's, Romberg sign. They are signs to indicate presence of certain problem, neurological problem. Do you recognize any of these signs, guys? Romberg, Brudzinski, Kernig's, any of these signs? Tell you that there is a specific disorder? Yeah?
Not really.
What about the last two? Brudzinski, Kernig's. They together tell us if they are positive Brudzinski, positive Kernig's. This means there is
Is Romberg the one where they lose their sense of balance with their eyes closed?
yes, very good, Michaela. Very good. The Romberg is this one. This is to check the patient balance. They ask the patient to stand straight, and then they ask the patient to close their eyes. If they close their eyes and start to swing from side to side, it means that there is loss of balance. It is positive Romberg sign, and that might be issue with what part of the brain?
The cerebellum.
The cerebellum,
Cerebellum.
because this is a balance. Very good, very good. Then Brudzinski and Kernig's sign, they are signs of meningitis. Meningitis, guys. The Kernig's sign, if patient has meningitis, while the patient has the hip and knee flexed like this, the nurse started to straighten the knee, the patient will resist. The nurse cannot fully extend the knee because the patient will resist. If the patient resists or show pain while the nurse try to extend the knee, this is a sign of meningitis. We call it Kernig's sign. Kernig's with K, and this is we try to extend the knee with the K. Yeah, so Kernig's is the knee. When you try to straighten the knee, the patient resists. This means meningitis. Another sign, it also for meningitis, we call it Brudzinski sign. It is at the neck. There is neck rigidity. So when the nurse try to passively flex the neck, the patient will resist and will flex also both legs. Patient reflexly will pull and flex their own legs if the nurse try to flex the neck. So this is Kernig's, this is Brudzinski, and both positive in meningitis. Yes?
Mhm.
Remember? So this is why I said this is a quick review to remind us things we have seen maybe more than 4 months ago. So we need to remember it all. Moja Bing, I just saw your chat. I'm sorry. So you said, I don't quite understand the diagnostic part. Is it we choose program? No. Green light, guys, is not this at all. Green light is after you pass your exit, you pass a predictor. This is a green light. By the way, I have 15 from the weekenders already green lit. They just came, got their predictor, and they are green lit. Yeah? So green light is that simple. You just take a predictor. If you pass exit 2, come take a predictor. If you need exit 3, you will take exit 3 and then the predictor. This is a green light. The other shebang, all this, it's a way how to study to yourself, for yourself, to prepare for the NCLEX.
Got it. Thank you.
You're welcome. Okay, so let's get back to our neurological disorder. We were doing the signs. And then meningitis, guys. If the meningitis diagnosed, do we just depend on these signs to diagnose meningitis, or what the nurse anticipate will be ordered to confirm meningitis? What test the doctor will be ordered?
Is it a lumbar puncture?
Lumbar puncture. Wonderful, Roxy. Lumbar puncture test. So how they do lumbar puncture? How would they position the patient during lumbar puncture? How to position the patient?
Prone.
On their side.
Trendenberg, sorry?
They position them on their side.
On their side. Yes, exactly. You need the back, right? You need the back of the patient. Yeah? So you position them on the side and flex the hips so they have their back curved. You want to expose the spinal column because they will put a needle to withdraw lumbar puncture. They will puncture at the lumbar area between the lumbar spine. They will put a needle. They will poke the patient to take what? They will withdraw what from the patient?
Bone marrow,
Spinal-
CSF.
spinal-
Yes.
spinal
CSF,
fluid?
cerebrospinal fluid. Very good. CSF, the fluid, the cerebrospinal fluid. So we will take this fluid out. Very good. And they test it in the lab to diagnose meningitis. So they can have the patient on the side or sitting and leaning forward on a table. Curl the back, lean forward on a table. So either sitting or on the side, curl your back like the cat. You know how the cat curl their back? So they curl the back, so the space between the lumbar spine will be wider, so they can go with a needle between lumbar spines. Which lumbar spine? How many lumbar spines we have? How many lumbar vertebrae? 7, 12, 5. How many?
7.
Less?
I was
Who
gonna say
less?
5.
5. We
Five.
have 5. The 7 is the cervical. So we have cervical 7. We have 12 thoracic spine. We have 5. Do you know the breakfast, the lunch, the dinner? Breakfast, lunch, dinner time. Breakfast at 7 o'clock, lunch at 12 o'clock, dinner at 5. These are the numbers of your spine. The cervical, 7 cervical. You have 7 in your neck. You have 12 in your chest, the thoracic. You have 5 in your lumbar. So remember the breakfast, the lunch, the dinner. So they will take the cerebrospinal fluid, the CSF, and they will check it in the lab. It will diagnose meningitis. It will say either viral or bacterial, right? It could be viral, bacterial, or any other reason. Which one? Viral is number 1, bacterial is number 2. Which one you will give antibiotic? 1 or 2?
2.
2. 2. Be careful, guys. Any bacterial, any viral infection, never give antibiotic, right? If it says viral, even viral pneumonia, only the bacterial infection, we give antibiotic. Okay. What isolation precaution? If the patient has meningitis, what isolation precaution? Is it airborne, droplet, contact? What isolation precaution? Droplet. Droplet. Very good job. Droplet with bacterial meningitis. Very good. Nowadays, the standard viral meningitis is a standard isolation precaution. Kind of tricky, but note it, guys. Note this. Bacterial is droplets isolation precaution. Viral is standard. For droplet isolation precaution, what PPE I'm going to wear? Should I put N95 for droplets isolation precaution? What kind of PPE?
Glove.
Gown, glove, facial shield.
Sorry?
Gown, glove, face shield.
All of them? Give me one only. For droplet, I will use only one. We have lack of supplies. And it is not select to all that apply question. Give me one only for droplets.
Face shield?
Face mask. Sorry, surgical mask. Surgical mask. I will do the surgical mask. It is droplets, right? So I want to prevent the droplets from getting to me. So this is a surgical mask. Yes? Okay. Remember, the sign and symptoms will be neck rigidity. The neck is so stiff, so rigid. What else could be finding, guys, in meningitis plus neck rigidity? Yeah. The nurse expect what finding during assessment?
Difficulty turning the neck or...
Yeah, rigidity, neck rigidity. Fantastic. Yes. What else? Photophobia. What photophobia means? Photophobia.
Sensitivity to light.
Yes, sensitivity to light. Yes. Headaches, right? They have headache because meningitis is inflammation around their brain, their spinal cord, all the meninges. The meninges are the covering of the brain, right? Meninges are the covering of the brain. So if there is meningitis, like inflammation in these covering, that will give headaches, right? And if there is infection, do we expect fever? Yeah, fever.
Yes.
And anything in the brain could complicate, like with seizures. Could meningitis give seizures? Yes or no? Put on the chat. Yes or no? Seizure could happen? Yes or no? Yeah. Yes. Seizures could happen with meningitis as a complication. So one of the select all that apply, if there is select all that apply, if there is seizure precautions, I will take it. Hey, Andrea, good to see you. So seizure precautions should be taken. I have no idea if you guys behind the screen are here interactive or not interactive. I should push to like open the screen. So uh, uh, let's make it more beneficial. Let's make it 100% beneficial to you. If you are at work, I understand. That's fine. But is the 30 people here, all of them at work? No, right? So if I am behind the screen, I will not give myself 100% attention. I know myself. If I'm behind the screen, I will not give 100% attention. If I am committed to be there, to put time, I will give 100% attention. So after the break, we will have a break at 12. After 12, I hope everyone will have the screen up, cameras on. Deal? If it is deal, put me deal. Put me deal.
Yo.
Deal? Raiden, I don't mind if you're upside down. That's fine.
I had to not my phone.
It's okay. It's okay. Okay. So this is meningitis. Next disease. Next disease is we are doing neurological disorder, guys. Next disease is autonomic dysreflexia. What is that? Let me explain. Okay. So Damien, look at this. There's a spinal cord in here, right? Inside the bone, we have the spinal cord, right? The spinal cord connect what? The brain to the body. Yeah, this is if you have pain in our hand, how the pain will be felt by the brain. The nerves take the pain from the hand. The nerve go up through the spinal cord, deliver the sensation to the brain, and the brain will tell there is a pain. Yes? So the spinal cord, guys, it connects your brain to the body. Do you agree? Yeah?
Yes.
So spinal cord connects your brain to your body. So autonomic dysreflexia is higher spinal cord injury above thoracic vertebrae, above the thoracic 6, T6. We have 12 thoracic, right? So when there is damage above thoracic vertebrae number 6, this is autonomic dysreflexia. So let me tell you this, how you feel you want to go to the bathroom, like how you feel, how the sensation of I want to pee, it happens. There is full bladder. Once the bladder is full, the nerve will take this fullness sensation through the spinal cord up to your brain. The brain will say, oh, my bladder is full, I need to go. So you go to the appropriate place, right? How you feel you want to go, how you feel the pain in your leg, like if you have tight shoes, how you will take off the shoes, how you know it is uncomfortable, take off your shoes. Again, the sensation, this pressure sensation from the foot go through the nerves, from the nerves, it will ascend, it will go up to the brain through the spinal cord. So the spinal cord delivers sensation to the brain. There is tight shoes, I will take it off, right? So there is connection between your body and the brain. So far, so good?
Yeah.
Now the spinal cord is injured. How the feelings will go to the brain? Bladder is full, or there is impacted stool, or I have tight clothes. That will not be interpreted in the brain. Do you agree? Because the connection is cut. The line is not working anymore. So, but there is annoying sensation. So if the patient with autonomic dysreflexia, they have full bladder, there will be some signals, but the signals are not clear. There is full bladder. So the brain will sense there is something happening, but not exactly know what is happening because there is no correct line to connect the sensation. So the body will start to secrete adrenaline and will go into the sympathetic, which is fight or flight, because this is stressful. There's something happening. I have no idea. There's something wrong. So the body will get into sympathetic drive. What sympathetic drive cause? What will happen to the blood pressure if it is on sympathetic, the fight or flight?
It'll rise.
Yes, it will increase. What will happen if there is, what will happen to the heart rate?
Increase as
Gonna
well.
go up as well.
Increase, right? What will happen to, like, are you going to start sweating? Yes?
Yes.
Yes, this is autonomic dysreflexia. When there is stress under the level of thoracic 6 and the brain can't know exactly what is happening, that will put the body in autonomic dysreflexia, which is sympathetic symptoms like hypertension, but the pulse will go low, guys, not high. It will be hypertension, bradycardia, headaches, because the adrenaline will cause headaches, flushing of the face, sweating, blurry vision, anxiety, agitation. This is autonomic dysreflexia. Yes? What are the reasons? Simply, there might be tight closing. There might be full bladder. There might be stool impaction. It might be pressure area, like they are sleeping in bed, they are paralyzed. It might be their body under, there is pressure area, there is pain. I cannot sleep on my back. This is so painful, right? But they don't have any idea what is happening. So the body will start to react. You got the idea. You understood it, right?
Mm-hmm.
Yeah.
Okay.
Yeah.
Now, you want to, if the patient has the symptoms of autonomic dysreflexia, you want to set the client up. You want to prevent further brain damage from the high blood pressure, because this is so high blood pressure. Number one, set your client up. Nursing care, I will have him sitting up so the blood pressure will not damage the brain. And I will give medications, right? Right? What medication can work fast? The vasodilators, to dilate the blood vessel so the blood pressure will go low, like hydralazine. They give hydralazine. It's a vasodilator, right? And then after you prevent the further brain damage, you want to find the reason. You want to find the cause, right?
Mm.
So this might be asked in a question like, what the nurse assessment need to be done? Like, patient presented with autonomic dysreflexia, what assessment need to be done? You want to assess if there is full bladder, correct?
Yes.
Yes. You want to assess for constipation, correct?
Mhm.
It might be impacted stool. You want to assess for pressure injury. Check the skin, the pressure injury. Yes, it might be this pain caused the autonomic dysreflexia. Check for cold room. The room temperature might be cold and they have this freezing sensation, but they don't understand that this is from the cold. Tight closing. So if there is full bladder, what you need to do? What action? You tell me the action and I will show the answer to see if you give me the right answer. If there is full bladder, what nursing action?
Back
Have
pain.
them
Encourage them
Have
to
them
use
void.
it.
Straight cast.
Yes,
Well,
straight
that's
cast.
it.
Very good, very good. If there is constipation, remove impaction. If there is pressure injury, reposition. Remove the painful stimuli. If it is cold room, what are you going to do?
Give him a blanket.
Give a blanket.
Blanket, change AC, right? Tight clothing, what you're going to do?
Remove it.
Yes, loosen the clothes or remove that. Yes, so could be select all that apply. You might loosen the clothes, you might put them in upright position, check for bladder distension. All these should be done with autonomic dysreflexia. Yes, got it?
Yes.
Yes, hopefully you put notes now in the final lab packet. Final lab, it has autonomic dysreflexia briefly. If you would like to put hints to yourself, so when you review it, it will be making sense. Okay, next disease, neurological disorder. Okay, sometimes they give you word like laminectomy. And I hate these words, what this is. So what is laminectomy? Ectomy means what?
Remove.
To remove.
Yes, surgical removal. Very good. Surgical removal. So now they removed the lamina. What is lamina? Simply, guys, this is a disc. You see how there is disc between the vertebrae? Yeah, each two vertebrae, they have a disc. So laminectomy, they remove one of these. So surgical removal of the spinous process to treat compression. Sometimes there is compression on the nerve, like sometimes these ones, these lamina, compress on the nerve, so they will just remove it. Okay, so because nerve compression, it causes pain, right? Pain, numbness, paresthesia. Sometimes if the nerve is motor, it will cause paralysis, because we have two types of nerves, guys, right? Some nerves deliver sensation, some nerves deliver motor function, right? So the nerve delivers sensation. If it's compressed, it will cause paresthesia, which is numbness. If there's compression on the nerve, which deliver motor function, that will cause paralysis or weakness, right? So nerve compression could cause paresthesia, could cause paralysis. Yeah. So we need to remove the lamina, which cause compression. Lamina could be in the cervical area, could be in the thoracic, could be in the lumbar, right? So how the question comes if they ask about laminectomy? They ask about what you want to assess after each laminectomy. Like if there is cervical laminectomy, if they have surgery in the cervical area, what you want to assess after that? If there is laminectomy in the thoracic area, what you want to assess? If there is laminectomy in the lumbar area, what the nurse should assess after laminectomy?
Lower extremity.
So good job. After which area you do
For the
lower
lumbar?
extremity? Good job, Justin. So for the lumbar area, guys, assess lower extremities, lower limb function. Also in the lumbar, it control urine and stool. So assess for bladder distension, assess for stool impaction. So after lumbar, assess bladder and rectal function plus lower limb function. If it is cervical laminectomy on the top, cervical one, you assess what? The nerve from the cervical area control the upper or lower limb?
Upper.
Upper limb, right? So you assess upper limb function with cervical laminectomy. For thoracic, you assess for breathing and the cough mechanism, because thoracic laminectomy, it gives nerves to the thoracic area, so assess breathing and cough mechanism. Okay? Make sense?
Yes.
Yes, very good. After laminectomy in general, like somebody have surgery in the back, how the nurse will move the patient. Have you heard or have you done
Log roll.
the log roll? Yeah? Log
Yeah.
roll. Because you want to just make sure you don't move the vertebral columns, the spinal column, right? So log roll movement, very good. Move it as one piece. Then limit sitting because it is pressure on the spine. So sitting for 30 minutes at a time. And watch for any pneumonia or atelectasis, because after surgery, any surgery post-op, you want to make sure they will not get pneumonia or atelectasis. What is atelectasis?
It's the collapse of the alveoli in the lung.
Collapse, lung collapse. Very good. Collapse will be, alveoli will be collapse. Very good. How to prevent this, guys? How to prevent collapse? How to
Spirometer.
incentive spirometer. Very good. How you advise the patient to use the incentive spirometer? Should they blow or suck in with incentive spirometer?
Suck in.
Suck
Second,
in.
it's an
Yes.
incentive.
Incentive spirometer. Do you remember what I told you? Incentive spirometer, IS. So I what? IS. Suction. Incentive spirometer, suction. Right? Very good. Then what about the peak flow? Peak flow, you blow. It is different. Peak flow, this is for asthma. But I remind you how to use each machine, how to instruct your patient to use a machine. Peak flow for the asthma, peak flow, you blow. But incentive spirometer, it is, I ask the patient to suck in, okay? Then headaches. Headaches, guys, migraine, remember the aura. Before migraine, they have flashes of light. Yeah? How is migraine going?
Mhm.
There's flashes of light. There is, sometimes they see dark spots. Yeah? So this is called aura before migraine. There is migraine. Also, there is something called the cluster headache. Cluster headache, guys, it's a headache behind the eye. So behind the eye, the patient feels throbbing sensation. With any type of headache, what is your nursing care? What you do?
Lower blood pressure.
Monitor blood pressure, okay? Monitor it. If it is high, make sure you give the medication appropriately. If the reason of the headache is high blood pressure, yes. What else? Quiet environment.
Quiet environment, dark environment.
Yes, quiet environment, dim the light. Great. And give the medications like NSAIDs. And there is too much triptan to treat the migraine. Okay. So then Glasgow Coma Scale, guys. Glasgow Coma Scale for VN board, they will not ask you like what is the scale. Don't think they will be like Apgar score. You know, Apgar score, they give you finding and you tell the score. Glasgow Coma Scale for VN, they will not do that. They will not tell you what is the score. But for VN, what you need to know about the Glasgow Coma Scale, you need to know there is a verbal response. They evaluate patient on their verbal response. They evaluate patient on their motor response and their eye-opening response. Then, what is the lowest? The lowest is 3. The highest is 15. So the scale is Glasgow Coma Scale range from 3 to 15. Yes? And you remember to know that if Glasgow Coma Scale below 8, you need to intubate. Below 8, you need to, I want to hear it from you.
Intubate.
Intubate. This is Glasgow Coma Scale. So no, the minimum is 3, maximum is 15. And if it is below 8, the patient need to intubate. And this is details. I will not go over Glasgow Coma. I've never seen or heard it will be something. Also, part of coma, which is very late stage of coma, patient might exhibit these positions like decorticate. This is called the decorticate, like they flex in, and this is decerebrate. When patient exhibit this, any of these, it means severe, could be irreversible brain damage. This is very bad positioning. Okay. Yes, we're good.
Mhm.
Good refreshers, huh? I'm
Yeah.
trying to, is it fast for you?
No.
I'm trying to make it one day. Yeah?
No,
Okay.
good.
Mm.
Parkinson's. Parkinson's. What is happening in Parkinson's, guys? So there is something called dopamine. It's a chemical in our body. Dopamine is responsible for your muscle action. Make your muscle does its action well. Well means not rigid or not loose or hyperactive. Yes? So dopamine is important to adjust your muscle, make your muscle doing its function well. So we have two diseases have problem with dopamine. The first one is Parkinson's. Parkinson's, they have lack of dopamine. So lack of dopamine, it will cause muscle rigidity. There is no enough dopamine to make the muscle move smoothly. So there is rigidity. So this is Parkinson's. Remember the trap in Parkinson's. T-R-A-P. T with Parkinson, they have tremor. Tremor, the tremor in Parkinson's, it is resting tremor. Resting means a patient resting they do this hand movement during rest. If you give them something to hold, the tremor will go away. So there is tremor, and the tremor is resting during rest only. Do you see the subtitle?
Yes.
Yeah.
Yes.
Yes. Okay. So during rest, they will have the tremor. So we call it resting tremor. Then the R for, you tell me, the R for what? We just said it.
Rigidity.
Rigidity. They will be rigid. Rigidity. Look at the rigidity. All the muscles are rigid, like even their face muscle. They give you face mask. You have no clue. Are you happy? Are you sad? I am happy, but no facial expressions. So masked face muscle, masked face. Then they have stooped posture like this because there is rigidity in the back. Even they will lose their arm swing. When we walk, we're like this, right? So they lose the arm swing during movement, and they will shuffle. Shuffle like they cannot like step their foot up while they are walking. So there will be shuffling gaits. This is rigidity. Then akinesia. Kinesia is lack of movement. Akinesia. Akinesia. Lack of movement. P, pusher. The pusher is stooped. Stooped pusher. Yes? So this is your Parkinson's. And it is lack of what?
Dopamine.
Dopamine. So how I treat the patient, you expect what will be prescribed.
Dopamine supplements.
L-levodopa, carbidopa. Treatment is levodopa, carbidopa. Levodopa, carbidopa, this is called Sinemet. Sinemet is a dopamine. Yeah, they also give them amantadine. Amantadine. For Parkinson's, dopamine also important for the mood. Lack of dopamine cause depression, right? So the Parkinson's people, they will be depressed also. So they give them MAO inhibitor, MAO inhibitors for the depression. Because we know that depression, we have either SSRI or TCA or MAO inhibitors. So we give them MAO inhibitors. It works well with Parkinson's. Okay, Huntington disease. Huntington is opposite to Parkinson's, guys. Parkinson's was lack of dopamine. So Huntington is high dopamine. Increase in the dopamine. Okay? So high dopamine means hyper action, hyperactivity in the muscle. So the patient will move, involuntarily movement. Literally, you will see your patient going like this, moving their legs, moving their arms, moving their trunk all over the way. Yeah. So hyperactivity of the muscle. This hyperactivity or excessive involuntary movement, we call it what? What is this word?
Yeah.
Chorea. Yes. Chorea. Yeah, chorea. Have you seen, guys, in your clinicals, patient with chorea?
It's like when they jerk a little bit, right?
I'm not. It is not a little bit. They literally will be moving like this. See, like
Oh.
this, like this, like this all the time. Yes, they cannot sit still. Involuntary movement. So what do you think? What will be your nursing intervention with patient like this? Involuntary movement all the time. What is
Fall
your
precaution?
nursing? Sorry?
Fall precautions?
Full precautions, absolutely. Very good, Jose. Yes. What about daily living?
Overall, just
Bathing,
like keeping their
shaving,
area safe.
eating. Exactly. Make them safe. And they will need assistance with daily living because they cannot bathe, eat, right? Shaving even. Huntington disease, guys, it's a gene. They born with it, but it doesn't show symptom until late adulthood, like 30, 40. So they have the gene, they born with it, but show symptoms later. This is Huntington disease. Okay, almost. Are we still surviving? We started by the biggest, heaviest part. I meant to have this because it is still early, we can absorb. Are we getting this? Yes?
Mhm.
Yeah. Okay, then MS, multiple sclerosis. MS, multiple sclerosis, it is autoimmune disease. Autoimmune. What autoimmune means, guys? You can put in the chat what autoimmune means.
It means the body attacking itself from within.
Exactly, Katie. The body attacking themselves. The body just don't like certain parts in itself. Okay? So in MS, like Katie said, the body will attack some part of itself. What part will be attacked in multiple sclerosis, guys?
Myelin sheath?
Good job, Jose. Myelin sheath. The myelin sheath is the sheath around your nerve to make your nerve conduct the signals appropriately. So MS is nerve problem because myelin sheath is destroyed by the antibodies, by the immune system. So there is problem with nerve conduction. So nerve affect every function in the body, but the most commonly affected nerve pathway is vision. So MS mostly they have visual problems, vision problem. It could be partial blindness, could be complete blindness, could be blurry vision, could be diplopia. What is diplopia? Diplopia is
Is that the
Double vision.
double. Very good job. Double vision. Very good. Okay. Also, nursing care. Since they have nerve and conduction problem, you need to assign rest periods. Rest periods are encouraged and avoid hot bath. Hot bath, wow, hot bath should be avoided because it lead to increase in the muscle weakness. Do you know, guys, that was one day I was doing this. I was talking to someone and her test was the following day. She got a question on that, like avoid hot baths with MS. Yeah. So hot baths should be avoided because it increases muscle weakness. Treatment, it is autoimmune. Do we have cure for autoimmune? Not yet. Maybe later somebody will find out. So they do cortisol, corticosteroids to prevent progression. they give oxybutynin. This medication is important. Please note oxybutynin to treat urinary urgency or urine incontinence because they have weakness in their muscle because of the nerve damage happen because of demyelination. So they give oxybutynin, they give steroids to help MS patient. Yep. Another disease, we call it Guillain-Barré. Guillain-Barré syndrome. Guillain-Barré syndrome. This is also called ascending paralysis. Yes, good job. So look at her legs, they are weak. And then, oh my God, I don't want you to go up. Because if it goes up, it will affect what?
Respiratory.
The respiratory system. So this is Guillain-Barré. If you have patient with Guillain-Barré, what you need at the bedside? A ventilator. Make the ventilator ready. Make it ready because there might get respiratory problem because it is ascending paralysis. So the scenario of Guillain-Barré is patient had 2 weeks ago either respiratory infection or gastrointestinal infection. There was some kind of infection they have. And after 2 weeks, they started to feel weakness in their leg. This is a key word. So 2 weeks or 3 weeks ago, patient had either GI, intestinal, gastrointestinal, or respiratory infection. After that is resolved, 2 weeks later, they will start to see or feel weakness in their lower limb. This is Guillain-Barré syndrome. Yes, Guillain-Barré syndrome. It's demyelination also, but in the lower extremities. And it is ascending paralysis. So they give steroids, sometimes also ventilator support if needed. Okay? Okay. Another disease. What do you think? What is this, guys? Put on the chat. What is this? Let's look at the picture and guess. What do you see? What this could be? Okay, Moja Bing put lazy eye. Roxy pot, myasthenia gravis. Huh? What else? I want to hear from more. Huh? Ptosis. There is ptosis, Justin. You're right. It's ptosis, like a drop on one of the eyelids. Very good. Bell's palsy, summer. Okay, that is very good input. Very good job, guys. But the answer is Roxy, when? Myasthenia gravis. Why not Bell's palsy, summer? Because it is just in the eye, not the whole face. But you're right, if it is the whole face is drooping. Yes? Good job, Justin. You put ptosis. Yes, ptosis means very good. This is drop in the eyelid. But this is not the disease. I asked about the disease. Lazy eye, not really, because the lazy eye is not the eyelid. Lazy eye, the eye itself, Moja Bing, the eye itself will move somewhere, not the eyelid. But very good guess. So this is myasthenia gravis, which is another autoimmune. Guys, affect acetylcholine. Acetylcholine. This is autoimmune. It destroys this chemical substance. It causes ptosis, which is drop in the eyelid, and they treat with acetylcholine. They give something to treat to improve acetylcholine. Okay? Myasthenia gravis, they give treatment like neostigmine, pyridostigmine. They give steroids also because it is autoimmune problem. Also with autoimmune problem, we know there's antibodies, right? Autoimmune problem, it is antibodies, guys. So sometimes they do plasmapheresis to remove the antibodies. Last but not least, for neurological, is Alzheimer's disease. Alzheimer's disease, guys, it's degenerative brain disorder, affects cerebral cortex. Yes, Roxy.
I'm sorry, can you just go back? I didn't finish writing the last med. Okay, thank
Absolutely.
you. Sorry. I'm so sorry.
No worries.
Okay, thank you.
You're welcome. Alzheimer, guys, Alzheimer, it has stages, mild, severe stage, and there are 5 A's of Alzheimer. There are certain words like as sign and symptoms. Here's anomia. Anomia, like inability to know the name. I cannot remember the name of this. She's holding a shoes and she's saying, what do you call this again? So this is anomia of maybe the pot on the head. They cannot remember the name of this. Okay. Then there is apraxia, misuse of the object. Misuse, like she wanna write with the shoe. Apraxia. Why doesn't this pen work? Because it's not a pen, right? Then agnosia, inability to recognize familiar object through sensation. Like you give an apple while the patient is eating the apple. What is this? Are you giving me an egg? Right? So this is agnosia. They cannot recognize familiar stuff through their sensation, even sounds. They hear the siren of the police and they say, oh, somebody is laughing. So they cannot recognize sensation, agnosia. Amnesia, it is amnesia. Then they have aphasia. Aphasia, like they cannot